Hi, my name is Carol Schumacher, and I am a member of the Buffalo Neuroimaging Analysis Center's Advisory Council, and I'm here with 4 other members of the council to interview one of our researchers about a recent published paper. And the researcher is Dejan Jakimovski, and I'd like to introduce him to you now.
Hello, Carol. Thank you for your introduction. I'm more than happy to answer any questions pertaining to our latest paper on patient-reported outcomes and their relationship with MRI-based outcomes in people with multiple sclerosis. And looking forward to this interview.
Hello, my name is Patricia Pico, and I'm here from the Advisory Council as well to talk with Dr. Dan about this study. Dr. Dan, what did you start out to learn when you began this research project?
That's an excellent question. We wanted to understand which structures anatomically, when analyzed by magnetic resonance imaging, by MRI, which structures and how much of pathology in those structures, like lesions and atrophy of those structures, decreasing the volume, is associated with patient-reported outcomes. And we wanted to understand that because by learning which structures are driving the patient-reported outcomes, we can later on use that to create ways of detecting and measuring and potentially even preventing pathology in those structures, and therefore improving the patient-reported outcomes as one of the most important outcomes in people with multiple sclerosis, in my opinion.
Thank you. This has all been very interesting and informative. I'd like to introduce Mark Stecker. Mark has another question for Dr. Dan.
Hi, Dan. This is Mark Stecker. I'm a MS patient and patient advocate and member of the Patient Advisory Council. What were the outcomes of the study you just described?
Yes, so the study had several outcomes of which I'm going to present. The first outcome was that the amount of depression reported by the people with multiple sclerosis significantly influenced all patient-reported outcomes, from both physical to psychosocial to mental outcomes from our list of patient-reported outcomes. They were all affected by the depression being the amount of depression that was reported. When we look deeper into that, we tried to understand which structures were related, and what we found out was not necessarily the lesion volume, not necessarily the whole brain volume, but actually a very specific deep gray matter structures were the ones who were mostly driving the patient-reported outcomes in people with multiple sclerosis. By saying deep gray matter structures, these are the thalamus, the caudate, the putamen, the globus pallidus, and the hippocampus, as several important structures in the center of the brain that previously have been implicated in multiple sclerosis. But in this study, we showed that even after correcting or adjusting for the depression effect, the size of the deep gray matter volume, the size of these structures like the thalamus, were definitely associated with how much patient-reported outcomes were being presented. And in a direction where smaller thalamus has always been associated with worse patient-reported outcomes, smaller hippocampus and smaller putamen with worse outcomes reported by the patient.
Thank you, Diane. That's all fascinating. I'd like to introduce next Mr. Mitch Sturgeon, a member of the Patient Advisory Council.
Thanks, Mark. The question I have for you, Dejan, is, were there any surprises that came out of this study?
There was a surprise where we saw that the traditionally considered important metrics of multiple sclerosis were not the main drivers of patient-reported outcomes, like the lesion volume that is typically being talked about and measured in multiple clinical trials, or even now in daily routine MS care. the lesion or these plaques of multiple sclerosis not necessarily were the ones who were driving the life satisfaction or the life satisfaction of these patients. So what we were surprised is that what we routinely measure, it's not necessarily what is driving what is the most important to people with multiple sclerosis.
Thank you. The last question is Linda Saffrins.
Hello, thank you, everyone. My name is Linda Saffron, and I too have MS, and I work with BNAC and with the Advisory Council. Dan, we wonder what further studies does this study suggest?
Excellent. And that's always the most important. What are the implications from our study? First of all, we wanted to, if we were going to develop a future study, and definitely we are planning to do so, is we want to understand how are these changes are being actually occurring and in relation with patient-reported outcomes. The second most important thing that we need to study in the future is, will therapies that target these deep gray matter structures like the thalamus or decreasing the amount of volume loss in the thalamus is going to reflect by improvement of patient-reported outcomes or not. And this kind of longitudinal design study where we will follow patients over a long period of time and measure the actual amount of volume loss versus the amount of improvement or decrease in patient-reported outcomes will be very important in order to understand not only the relationship, but also the temporal relationship over time, how these relationships change in people with multiple sclerosis.
Thank you very much. And we hope everyone has enjoyed this first interview by the BNAC, Buffalo Neuroimaging Analysis Center Advisory Council. And please check the website for a printed version of the summary of this study. Thank you.